you realize how nutty 30-minute lab is. So please don't try to use that time to catch up with your friends and talk about lunch or dudes or girls or movies or anything like that. You get in there and you start practicing, okay? I mean, it's a really frantic time. It's nuts. So, LI4 you already know, yes?
Yes.
Perpendicular probably, yes?
Yes.
Yes. Okay, next thing we have, let's do, I'll probably do that one first, and then I'll probably stomach 40. Where's stomach 40?
Down on the leg.
Down on the leg. Give me your leg one. Okay. This is so, boom. Okay, pretend this is a stool. Okay, so stomach 40 is halfway between the knee joint and the lateral malleolus, yes?
Yes.
Okay, and you just kind of go like this. Now, here's the edge of the tibia here. If I did it right here, that would be stomach 38, right? Okay, what's stomach 38 good for? Yeah, it's an empirical point for shoulder and a bunch of other stuff too. Stomach 40 is a great one for phlegm and damp anywhere in the body. Yeah? Okay, it's also good for leg stuff. It's basically, when I always go from the inside outward, I let my finger creep, and when it first hits that depression. It's not way down here. It's not right on the tibial band either. It's just whoop, right there. So I would hard pressure with that guide tube. Okay, you guys remember, if you want to be friendly to her, you do it quick. Boom. That's it. Do not make this a torture movie. Okay? So you right? Okay. So that's one. Yeah, toss me. Okay. So there's that one. Let's do Sangel 5. I'm not going to do all the points on here, but I just want to show you the weird ones. Sangel 5 is where?
Too soon.
Too soon on the arm, yes. Sangel 5 is a great one for just helping regulate fluids anywhere in the body. Okay? It's also good for immune system. So it's about too soon up, right in the hole. Do not go over bone. That's pretty much, I feel, where the hole is. Again, this is a perpendicular one, firm. That's it. See how fast that takes? It's not a torture. Okay? I like Roz too much to torture her like that. Some of you other guys, I'll do it slowly. Okay, now let's do Bitong. Bitong is an extra point. Yes? Yeah, you're right on that. Okay. Don't do as I do, do as I say. Okay? I'm the teacher. I promise I swabbed my fingers, as you saw beforehand. I don't know where her legs and arms have been, but that's okay. Okay, so Bitong, we've got Li20 at the bottom of the nostril, yes? Mm-hmm. Bitong is kind of at the top of the nasolabial group, yes?
Yes.
Okay, what I like to do, I'll start halfway between and then thread upward. Okay, so now to do this one, don't freak out because you're on the face. You stop making that face right now. Okay, you get used to this. You're going to do this a lot on patients. Be comfortable. Notice how I'm not just hands-free doing it. I'm supporting the head. When she's down, okay, I'm warning her. I'm basically kind of giving her a prep. I'm providing pressure. Tap. Okay, now you don't let it just hang. Now notice what I do with this hand. I'm pressing down. I'm basically pinching the skin a little bit to allow it to go a little bit until you bottom out. You doing okay? Yeah, it's no big deal. Basically, I'm giving her whiskers. Notice how I'm doing it up.
Can you turn? Look over here, Ross. Look over here.
Little Halloween kitty cat.
Can you almost do the other side of
Yes, we're going to do the other side.
Correct.
Yes.
So you're going in this way, not this way?
Correct. I'm doing it kind of at an angle in towards the nose. Now, you say, well, is that tonifying or reducing? I'll be honest with you. For some of these face points, there's pretty much one really good way to do it, regardless of whether you're tonifying or reducing.
But I was thinking, if you're doing like, you can do Li20 up, would you go
Yeah, I would recommend going inward towards an angle. Okay? So now on the other side, so again, I'm pressing firmly with that guide tube in. Whenever I press firmly, you're stretching the skin. Doing okay? There. Hey, everyone, look, she's got a little whisker. Halloween costume. Okay, so what's the other one we're going to do is bladder 2. Got a few more minutes here. Bladder 2 is a tricky one. Top of the eyebrow. You can make this really. You doing okay, Russ?
Mm-hmm. You always do both Bitong?
Yes.
Okay.
Yeah, always. Okay, because most of the signs, I don't care if they're like, well, it's only my left nostril. It's okay. I want you to do both.
Oh, bladder
So,
too, right?
well, bladder, urinary bladder 2. Okay. Urinary bladder 2 is the inner corner of the eyebrow. I want to give her angry eyebrows now. Be comfortable. This is why you want to like make sure your hands are clean and all this stuff. My hands are clean, I promise. Okay? Just trust me. Okay? So I'm grabbing her skin of her eyebrow here. I'm giving her some. Doing okay? Oh my God. Okay. Angry eyebrows. Do not let this dangle over the eyeballs. This is horrible. You're like, what the? Jesus. Okay. Now to get a hold of that and to get it in like that, I have to pinch the skin of the eyebrow. If you do that, it's not painful. It's not a big deal. If you be very, very tentative and you're like, oh, I don't want to touch him, it's going to hurt. I promise you that. Okay. And again, this is one of those to where if you're trying to be too gentle, you're going to hurt them. And I say this every time people forget.
Is that little bump where the needle ends? Yes. Is that as far as the needle is in?
Yeah, man. It's in there deep. How you doing, Russ?
For on this one, I couldn't tell. Do you start where the point is, or do you start a little off like you did on the?
For this one, I started off a little bit.
A little bit off. Okay.
Because like I said, I'm threading that pretty deep.
Okay.
Excuse me. Okay, gallbladder 14. Middle of the eyebrow, I think it's one soon up. Okay, so it's here. Now, there's not a lot of skin or muscle here, right? So what I have to do, I have to take the skin and we have to pinch it. We talked about this last week. This allows it to lift. Firmly press with the guide tube in. Tap. I'm keeping that pinch now. I thread it down. You doing okay? Okay, look how deep that is. Ooh. Ah. Now, is she in pain? Did that cause agony? No. It's because I'm awesome. What?
Is it the transverse?
Yes. Okay, so what we have here, good question. You have perpendicular. Perpendicular. Okay, these have changed angles a little bit, but that's okay. Our intention was perpendicular. You have oblique, bitong, gallbladder and bladder 2, and gallbladder 14. You have its transverse or horizontal. Okay. What else do we got there? Oh, yin tong. Yin tong has dual functions. Okay. Yin tong is one that's great for sinus. It's also really good for emotional, for calming the shen. Pretty much I do that in Shen Men in the Year. It's almost on every patient just to chill them out. Like, oh, I feel so good. And you can tell your patients, you just say it's there to make them smarter, and they're like, yeah, all right, I'll do that. So again, this is another one that's considered oblique or 45 degrees. Some people will say perpendicular, but for the most part, it's oblique. Pinch the glabella. Firm pressure. You keep that pressure while you're needling. Boom, now she's getting an antenna.
So what angle is that technically?
That would be considered oblique, about 45 degrees. So now we have a transverse, oblique, 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 perpendicular, perpendicular, perpendicular. Okay? So ideally when you're doing this treatment, you do it on both sides. It is a very powerful sinus draining technique. I guarantee it'll work on about 80% of your patients at least. There's a few that just it's a struggle and you got other stuff you need to do to them.
Do you always do that?